Thank you very much. Dear colleagues, friends, so we will discuss a little bit what we can do with our femtosecond lasers, what will be in the future, and what we will see for tomorrow. So at first we have three properties we have to see. The scientific advantages, which we'll see theoretically, also the physical properties, but at the end, as we have seen already, importance is that we have a clinical benefits with the femtosecond laser. The property is clear, that's multiphotonionization, so with free electrons in an avalanche process. So at the end, we need an energy of 1.3 joule per centimeter square. So that's definition, and now we can play with it. What we can do? We can decrease the pulse duration, we can small the pulse. So what we can see for the future, so if we are able to decrease even the pulse to at a second, it is set at 10 minus 8 pulse, and we open a little bit the largest numerical aperture, then we should be able to make a higher scanning of the pulses of the femtosecond lasers. So then we were some at the gigahertz range, and that has the target that we even decrease the energy with the application. So we have less side effects with our procedure. That will be the target for the future, to use less energy and to be more precise. First of all, we have published for the cornea the advantage for the femtosecond laser. So we have compared corneal LASIK with femtosecond laser with the LDV we use, and with the mechanical keratoma. So we have also seen that we have a better recovery of the visual acuity postoperatively at any time. You have seen we are more precise, so we can rely on the deepness of the cut with the femtosecond laser, while with the microkeratom we have a much higher range. Why is it so important? Because if we can rely on the thickness of the cut, so we can make thinner flaps as 19 microns on the cornea, and so we have more reserve of the stroma. What we have also seen in another publication which we did is that we have postoperatively less interface edema with the femtosecond laser comparing with the microkeratom, which is significant in this study. It is said that's also one of the advantages, clinical advantages for recovering the visual acuity of the one side, and other side to have a better contrast visual acuity in the first days postoperatively. Let's go to the lamellar keratoplasty. This is very elegant today with femtosecond laser to perform lamellar or deep lamellar keratoplasty with the femtosecond laser. So you can cut at any deepness of the cornea. Here at the graft, you have only the centration of this with artificial chamber, and then you can easily cut with the femtosecond. The main thing is that you can rely also on the measurements, as you see in the OCT, and then you can perform your procedure of the lamellar keratoplasty, as you see here. Once done, here in the special case, it was a scar in the first third of the cornea, so we make a cut of 350 microns in deepness. We mobilize here the graft, and then we are ready for starting with the patient eye. So we just switch. That's very practical. The laser is just nearly on the same place. Here you see the scar, which we have to cut out of this cornea in our surgery room, and then we perform the same procedure on the patient eye, as you see here. But even you have a scar, it is possible to perform the procedure with the femtosecond laser. You have some tissue bridges, yes, at this level, but at the end you can easily take it away. Then just you put at the end the graft and make your suture at this level. Make the suture. The suture is necessary because for 350 microns they won't hold of its own. Okay. Then we switch the cataract for the flaps. We have the first study for the LDV in 2014. So we have to show that we can cut very smoothly, that we have the lens fragmentation. We begin with 6 or 8 pieces, or it depends of the time we have. We can even use 16 pieces to take it after 3 hours to have a less phacoemulsification time. But what is in our other study very significant. That's also a special case as a child, which we have performed. Is 8 years old. It's very practical because it is quite difficult to perform a capsulorhexis of child's eye, and so it is very easy with the femtosecond laser to make his fragmentation for the posterior pole cataract. Then all the time we take a look if there's a free flap to be sure if it is the case, but it is nearly always the case. And then make a little bit faster. So make an hydrodissection, and once it is done, then you can perform and take out the pieces only with the aspiration. You don't need, in these special cases, phacoemulsification. So in these special cases, we have an amblyopic eyes with acute, visual acuity of 0.1 at the beginning. And it was even surprising, 8 years old, that we have a girl that we have an increase of the visual acuity at 0.8. And for now, we make therapy, amblyopic therapy, and it remains stable for the moment. But it's one of the advantages of the femtosecond laser, having, for example, for pediatric cataract. Then we have performed a bigger study of femtosecond laser versus conventionally. What is important, what I want to show for the future, is not only technical possibilities to make it fast, to make less energy, and so you need also a navigation system. So also the OCT should be better for the future to analyze it at any time for knowing where you are, or also where you are cutting. And so also this 3D high-resolution OCT is available for now, but for the future, we work also for another system. And so you can very well analyze where you make your cut, where you have your CO2, and if you have here an free flap. And for the future, you will see it maybe also on the OCT without looking in the clinical in the chamber anterior. I come to the conclusion. I think one of the main goals of the femtosecond laser is the repeatably and precise outcome with aim to offer customized medical solution for patients forever in difficult cases. Here in the special case, we have a low energy LDV Z8 laser. And what for us is very important that with this laser we remain the workflow as we have usually. So the doctor and the patient don't move. It's on the same place all the time. The surgery gets faster and faster, and I think for the future we hoping having less energy and make it even more precise. Thank you for your attention.